Today we're learning more about common ear, nose, and throat conditions and what you can do to seek help. Ear, nose, throat surgeon Dr. Ann Lowry joins us now from ProLiance ENT. Thank you so much for being here.
Thank you so much for having me. I am thrilled to be here.
Yay! Well, we're going to get straight into a topic that I feel like is on a lot of people's minds, sleep apnea. And I think a lot of people know about CPAP machines, but there's something new in this area. What is that?
Yes, absolutely. So sleep apnea is essentially where my patients, they go to sleep and then they feel like, I just can't get a good night's sleep. Their airway collapses down when they're sleeping and then they just can't take a breath. So the CPAP machine essentially has a mask and a hose, and it helps a lot of my patients. But for those who can't tolerate all that setup, there is the Inspire implant.
Oh, okay. And how does that all work?
So the Inspire implant is this tiny little device that we implant underneath the skin.
Okay.
It essentially is hooked up to the nerve that controls the movement of our tongue, so that we're actually able to move our tongue forward as we're sleeping, tenting up our airway so that we can actually breathe and get a good night's sleep.
Oh, well, that sounds like a win. And switching gears to, a lot of people also complain about their ears feeling clogged, popping on planes. This happens to me a lot. What is going on there?
Yes, so astute. So that is called eustachian tube dysfunction.
Oh.
The eustachian tube is a tiny little bridge between our ears and our nose, so that people, when it doesn't work, feel like my ear is really clogged. Do I have water in my ears? I can't pop it. When I go on planes, it really, really hurts. When I'm driving through mountains or when I'm going swimming and I dive down, there's a lot of pain because they're not able to pop their ears.
Yeah, and what can be done there? What can people at home know?
So absolutely. Essentially what we want to do is to be able to use a tiny little balloon. I go through the nose and I'm able to gently dilate up the eustachian tube so that you can finally pop your ears.
Oh, is that done like just by you then in the office?
Yeah.
Easy?
Yes, absolutely. Minimally invasive, go home same day.
Okay, I like to hear that. And what kind of results can people expect with something like that?
So my patients find that 75 to 80% of the time, they get almost near immediate relief, and the results are long lasting. So years down the line, they're still having good results. They can finally fly to see their, relatives over Thanksgiving. They can dive again. It's just a wonderful solution.
And like you said, minimally invasive, which is amazing. Lastly, stuffy noses. This always happens to my brother. We all know someone who's been congested, even without allergies. So what is that called when allergies aren't to blame?
So that is something called chronic rhinitis, essentially inflammation on the inside of the nose. Usually is due to tiny little nerves on the inside of the nose that are hypersensitive. It causes congestion, swelling on the inside of the nose, and a lot of mucus production that either drains in the back or will drain in the front. And all of my patients who are a little bit older, they find that I'm carrying handkerchiefs or tissues with me all day, and they're dabbing all day.
Okay, so what treatment options are out there for people that have like a runny nose nonstop?
So we have something like this, where it applies a little bit of heating or cooling to the nerve that causes chronic rhinitis, essentially tackling this problem at the source of the problem so that they can finally breathe better, and also they're not running all the time.
Is this also just in one day, out the other, or how does that work?
Yeah, so they'll come into my office, I'll numb them up, a little bit of topical anesthesia, and then this just goes in and they'll go home same day.
Same day, okay. How can people find you? What else do you want people to know about all the services y'all provide?
Yeah, so Puget Sound ENT, we have an office in Mill Creek, Edmonds, and Seattle, and we also have an on-site ambulatory surgical center. And so personally, I see patients in Seattle and Edmonds. I also see both children and adults, and I'm both Mandarin and English speaking, so I would love to help more patients in my community.
That's amazing. Why ProLiance ENT too?
So I find that we are typically able to get our patients in within the week, sometimes even same day. There are such things as ENT emergencies, so I want to be able to provide good care to my patients without a long wait.
Amazing. Thank you so much for being here. This was very interesting, and I love all the props.
Of course.
And to learn more, you can just visit the website that you see right there on your screen for some more information.
New Day Northwest is sponsored by ProLiance Surgeons Puget Sound ENT.